Sugary foods like cakes, fizzy drinks and biscuits are making up too much of our children's diets, according to Public Health England.
We love pop!
And that, of course, is having an impact on their health. We're seeing higher levels of diabetes, obesity and tooth decay. So they're encouraging a few small but substantial changes that should help keep the tooth fairy away, like swapping sugary cereals for plain cereals, sweet drinks for water or sugar-free ones, and sugary snacks for healthier ones too.
Joining me now is Kevin Fenton, the Director of Health and Wellbeing at Public Health England. Common sense really, isn't it, Kevin? So tell us, just how bad is sugar?
Yeah, well, the reality is that we're eating far too much sugar as a nation, and it's occurring across all age groups. But it's particularly bad among children and teenagers, where children are ingesting more than 50% more than the recommended daily allowance of sugar.
We talk about it all the time. What reasons do you think there are for people doing this?
I think people may not be internalizing the messages, thinking that it applies to other people and not themselves, not their family. I think there's also an issue of not really knowing how to make a difference in their diet, and that's one of the reasons why this campaign is so critical, because it gives simple steps that families can put in place to reduce their sugar intake.
Give us a couple.
Well, what we're trying to do is to get people to be mindful about sugar intake across the course of the day. So thinking about breakfast, moving from the sugary cereals into plain porridge, for example, or whole grain cereals, to think about fizzy drink intake during the course of the day and swapping to water, plain milk, low-fat milk, or certainly diet or sugar-free drinks as well. So these are simple things that can be done throughout the day.
Now, just a couple of days ago, Jamie Oliver compared sugar consumption to, well, smoking. He compared it to tobacco. He said sugar should also be taxed heavily, like tobacco is. Do you think it's time for drastic measures like that?
Well, I think the data are still out in terms of the real-world effectiveness of taxes, and that's one of the things that we're doing at Public Health England, to really look at the evidence on whether this would work and then provide advice to government.
Because it seems to sort of, normal people like me, that we're addicted to sweetness. We're addicted to that taste.
Yes, but taxation is really one tool that we can use to help to change that addiction. And that's why campaigns are important. Working with retailers and manufacturers are important as well. Government has a role to play in policy. We all have a role to play in helping to change the national palate away from our addiction to sweetness to something which is far more healthy.
Kevin, thank you very much indeed.
Great, thank you.